He sat down, looked at the floor, and said in a quiet voice, "Doctor, winter comes and I feel slower. My partner thinks I'm losing interest. I'm not, I'm just tired. And then I start worrying. And that worry makes everything worse." His partner squeezed his hand and added, "We still love each other. We still want closeness, but we don't know what's normal anymore." I hear this story often, especially from people over 60. The hard part is not only the body changes, it's the confusion, it's the silence. It's the fear that desire has an expiry date. Let me say this clearly. Wanting intimacy later in life is normal. Needing a different pace is normal too. Many people think a good sexual life means high energy, strong performance, and a body that responds on command. That idea can make winter feel like an enemy, because winter often lowers energy and raises stiffness, dryness, and aches. But there is another truth that surprises people. When stamina is lower, couples sometimes stop rushing. They start paying attention again, they speak more honestly. They plan warmth, rest, and time together. And for many, that creates a better, intimate life than the one they had when they were younger and always in a hurry. Lower stamina can push you toward a healthier style of intimacy. Slower, kinder, and more connected. Aging changes the body, but it does not erase desire. After 60, the heart and blood vessels may not respond as quickly. Nerves can be a bit slower, hormones shift. Some men notice erections are less predictable. Some women notice more dryness or sensitivity after menopause. Both may notice that arousal takes longer and the body needs more time to feel ready. None of this is a moral issue. None of this means you are broken. It means your body is asking for a new approach. The most common mistake I see is people treating this like a failure instead of a normal transition. Winter adds its own layer. Cold weather can tighten muscles and narrow blood vessels, which can affect comfort and response. Shorter days can affect mood and sleep. People move less, sit more, and gain a little weight without noticing. Joint pain can flare up, skin gets dry, and so do other tissues in the body. Even simple things like a cold bedroom or cold feet can shut down relaxation. Intimacy is strongly connected to comfort and safety. When the body feels cold, rushed, or tense, desire often goes quiet. That is not lack of love, that is biology. There is also the mind. In winter, many people feel more isolated. They spend less time outside, see fewer friends, and carry more worry. Worry is a strong desire killer. The brain does not separate work stress from relationship stress very well. If your nervous system is on high alert, the body saves energy for survival tasks, not for pleasure. So when someone tells me, "Doctor, my stamina is low," I also listen for what is draining them. Poor sleep, loneliness, grief, pain, financial stress, family stress, or the heavy feeling that can come with darker months. For people over 60, low stamina can sometimes be a simple lifestyle issue. But it can also be an early sign that something medical needs attention. I don't say that to scare you, I say it because it's empowering. Fatigue can come from anemia, thyroid problems, vitamin deficiencies. Uncontrolled blood sugar, sleep apnea, heart or lung disease, depression. Or medication side effects. Some blood pressure pills, some antidepressants, some allergy medicines. And some prostate medicines can affect desire and response. If stamina suddenly drops or you feel breathless, dizzy, or unusually weak, that is not something to push through, that is something to check. Good intimacy starts with basic health. A lot of couples also carry a quiet fear about safety. Is sexual activity safe for my heart at my age? In many cases, yes, it is safe, but the answer should be personal. A simple way I explain it in clinic is this. If you can do a moderate activity, like walking briskly or climbing a couple flights of stairs without chest pain or severe shortness of breath, intimacy is often safe. But if you get chest pressure, fainting, or severe breathlessness, you need medical advice before you push yourself. And if you use nitrate medications for chest pain, you must never mix them with certain erection medications. This is not about shame, it's about staying alive and well. Now let's talk about the promise hidden inside low stamina when energy is lower. You may need more recovery time, more sleep, and more gentle pacing. That can actually improve connection because it encourages couples to stop treating intimacy like a test. You can build closeness in ways that do not demand peak physical effort, long hugs, warm baths or showers together, slow dancing in the kitchen, sharing a blanket and talking without phones, giving each other a hand massage before bed, sitting close and remembering a good moment from your past. These things are not less than, They are often the exact bridge that leads back to a satisfying, intimate life. One of the most helpful changes I teach is the shift from spontaneous intimacy to planned intimacy when you're younger. Desire can show up anywhere, anytime. Later in life, desire often needs good conditions. Planning does not ruin romance. Planning can protect it. In winter, plan warmth. Plan time when pain is lowest and energy is highest. Often late morning or early evening, not late at night when everyone is exhausted. Plan a light meal instead of a heavy one. Plan privacy, plan gentle. When you plan, you remove the pressure of guessing and the fear of rejection. You create a calm path for closeness. Let me share a common real-life moment. A woman in her mid-60s told me, "Doctor, I still love my husband. But I dread intimacy because it can hurt now. And I don't want to disappoint him," her husband said. I thought she didn't find me attractive anymore. They were both suffering. But neither was speaking the real fear out loud. When we talked calmly, the solution was not dramatic, it was practical. Address dryness, go slower, change timing, use support pillows for joints. And create permission to stop if discomfort starts. The emotional relief on their faces was huge. Honest words can do what medicine sometimes cannot. Dryness deserves special respect in winter, especially after menopause. Dryness is not only about comfort, it can affect confidence and desire. Many women feel they should just tolerate it, and that idea is unfair. There are simple, safe tools. Regular hydration, a humidifier in the bedroom, gentle unscented soap, and avoiding very hot showers that strip moisture. For intimacy specifically, using a plain, fragrance-free lubricant can reduce irritation. Some people do well with vaginal moisturizers used regularly, not only during intimacy. And for some, local estrogen therapy is a safe and effective option. But that decision should be made with a clinician who knows your medical history. For men, winter plus aging can bring another common stress. "Doctor, things don't respond the way they used to." I want you to know that erections are not only about desire. They are about blood flow, nerve signals, hormones, sleep, and stress. High blood pressure, diabetes, smoking history, and high cholesterol can all affect blood vessels. Sometimes erectile changes are an early warning sign of cardiovascular disease. That sounds scary, but it's also an opportunity. Improving fitness, sleep, and blood sugar can improve sexual function and protect your heart at the same time. If you need medication help, that is not failure. It is a tool, and many couples feel relief when they stop treating it like a secret. Pain and stiffness matter too, especially for seniors. Arthritis in hips, knees, shoulders, or back can make certain positions uncomfortable and can make people avoid intimacy altogether. In winter, stiffness can be worse. Gentle daily movement helps more than most people expect. A short walk, light stretching, simple strength exercises, and balance work can improve circulation and energy. Warmth helps too. Heating pads, warm socks, and a comfortably warm room can relax muscles. If you take pain medicine, talk to your doctor about timing it so you are more comfortable when you want closeness. Comfort is not a luxury, it is part of sexual health. Now let's move to the part many people ask about, traditional foods and herbs, especially in winter. You mentioned ghee, dry dates with milk, and ashwagandha, and you want this aimed at people over 60. I'm open to traditional practices when they are safe, reasonable, and not sold as magic. Food can support energy, mood, and sleep. It can also create a comforting ritual that lowers stress. But we must be honest. Food and herbs are not a replacement for treating diabetes, heart disease, depression, or serious hormone problems. They are supports, not cures. Ghee is clarified butter. It is calorie-dense and rich in fat. In winter, small amounts can be helpful for people who struggle to maintain weight, who feel dry, or who need more calories to avoid feeling weak. It can also make foods more satisfying, which can reduce constant snacking. But ghee is still a saturated fat. If you have high LDL cholesterol, a history of heart disease, or you're trying to lose weight, you should keep portions small and speak with your clinician or dietitian. I often suggest using ghee as a flavor and nourishment accent, not as a large serving. A little can go a long way. Dry dates are another traditional winter food. Dates contain natural sugars, fiber, and minerals like potassium. They can be a quick source of energy, and many people find them warming and comforting. But dates can raise blood sugar. If you have diabetes or prediabetes, you should treat dates like a sweet, not like a free health food. Portion matters. Also, dry dates can be hard for some seniors to chew, especially with dental issues or dry mouth. A simple adjustment is to soak dates in warm water or warm milk until soft. That makes them easier to eat and easier to digest for many people. Warm milk is often used as a calming bedtime routine. For some people, it supports sleep, and better sleep supports desire and mood. But milk is not for everyone. Lactose intolerance is common, and dairy can worsen reflux for some. If milk bothers you, you can use lactose-free milk or a fortified alternative. The key is the calming ritual. Something warm, simple, not too sweet, not too heavy, taken at a time that doesn't disturb digestion. Sleep and sexual health are closely linked. When sleep is poor, desire often drops and irritability rises. If you want a gentle winter comfort cup that stays sensible, here is a conservative approach I often share. Warm a cup of milk or lactose-free milk until it is hot but not boiling. Add 1 or 2 soft dates, chopped or mashed. Add a small amount of ghee, like half a teaspoon, mainly for taste and richness. If you like, add a pinch of cardamom or cinnamon. Sip it slowly, not as a performance drink, but as a calming signal to your body that the day is ending. If you have diabetes, talk to your clinician about whether dates fit your plan or replace them with a spice-only version. Now ashwagandha. Ashwagandha is an herb used in Ayurvedic traditions. Some studies suggest it may help stress, sleep, and well-being in certain people. Because stress and poor sleep can lower libido and energy, it makes sense that some people feel better when stress is better controlled. But may help is not the same as guaranteed, and it is not risk-free. Ashwagandha can cause stomach upset in some people. It may interact with certain medications, including sedatives and medicines that affect the immune system. And it may not be appropriate for people with certain thyroid conditions. Rarely, liver problems have been reported with supplements in general, especially when products are contaminated or poorly made. This matters even more for seniors because people over 60 often take several medications. If you're on blood pressure medicine, diabetes medicine, blood thinners, thyroid medicine, sleep medicine, anxiety medicine, or immune-suppressing medicine, you should not add herbs casually. If you want to try ashwagandha, the safest path is to speak with your clinician and choose a reputable product that is tested for quality. Also start low and watch for side effects like sleepiness, stomach discomfort, or feeling off. If anything feels wrong, stop and seek advice. Your goal is steady health, not chasing a quick change. Also, I want to address a phrase many people use in winter: dry foods and warming herbs. Some traditions describe winter as a time when the body feels more dry, more stiff, and more cold, especially in older age. Whether you use that language or not, the practical message is helpful. Winter bodies often do better with warm, moist meals, enough healthy fats, and enough fluids. Soups, stews, cooked vegetables, soft grains, eggs, yogurt if tolerated, fish, and well-cooked legumes can be easier on digestion than very dry, crunchy foods. Hydration matters even when you don't feel thirsty. Dry mouth and dry skin can be signs you need more water, not just more lotion. Beyond food, stamina improves with simple daily habits that many people underestimate. Light strength training 2 or 3 times a week can improve circulation, confidence, and energy. Walking supports mood and blood vessel health. Gentle stretching reduces pain. If balance is a concern, do exercises near a counter or with support. If your doctor has told you to avoid certain movements, follow that guidance. The point is not athletic performance. The point is helping your body feel capable again. When your body feels capable, your mind feels less anxious, and intimacy becomes less scary. Let's talk about desire. Because many seniors think they should want sex the way they did at 30. And that idea can create harm. Desire changes form over the lifespan. In later life, desire is often responsive, meaning it shows up after closeness starts, not before. People wait to feel in the mood and nothing happens, so they assume desire is gone. But for many, desire is simply quieter at first. It needs safety, comfort, and emotional warmth. That's why a calm conversation, laughter, or gentle touch can be more powerful than trying to force yourself to feel something on command. Communication is a medical tool. I'm serious about that. When couples avoid the topic, they fill the silence with false stories. My partner doesn't love me, I'm unattractive, I'm too old, I'm broken. Those stories cause distance. And distance reduces desire even more. A better approach is simple and kind. I want closeness with you. My body needs more time. I'm worried about pain. I miss you. That is not awkward. That is brave, and it gives your partner something real to respond to. Intimacy grows when both people feel safe telling the truth. I also want to speak to people who are dating again after 60, maybe after divorce or the loss of a partner. This can bring excitement and also fear. You might worry about your changing body, about performance, about being judged, or about safety. Take it slow, choose partners who respect your pace. Consent matters at every age. So does protection from sexually transmitted infections, because STIs do not retire. If you have a new partner, testing and protection are responsible, not embarrassing. And if you feel pressured, that is a red flag. Good intimacy never requires you to ignore your comfort or your values. Sometimes low stamina is connected to low mood, and low mood is common in winter. Depression can reduce desire, reduce energy, and reduce self-care. It can also create a flat feeling where nothing seems appealing, even things you used to enjoy. If you notice sadness most days, loss of interest, changes in appetite, sleep problems, or thoughts that life is not worth it, please treat that like a health issue, not a personal weakness. Therapy, social connection, light exposure in the morning, movement, and sometimes medication can help. And if you use antidepressants and notice sexual side effects, talk to your prescriber. There are often options. Another important point for seniors is alcohol. In winter, some people drink more because it feels warming or helps them sleep. Alcohol can lower inhibitions, but it also reduces quality sleep, worsens mood over time, and can impair sexual response. For men, it can worsen erections. For women, it can worsen dryness and increase irritation. If you drink, keep it moderate, and do not rely on it as a pathway to intimacy. You want intimacy that you can access with a clear mind, because that builds trust and reduces regret. Let me return to the idea in your title, that low stamina can increase your sexual life in winter. It can, if you let it change your definition of what a good, intimate life is. A good, intimate life is not measured only by frequency or intensity. It is measured by how safe you feel, how respected you feel, how connected you feel, and whether your body feels cared for. Winter is actually a season where many couples can build that. More time indoors, more shared routines, more chances to create warmth and closeness. The body may move slower, but the relationship can become deeper. Practical timing can make a big difference. Many seniors try intimacy late at night, after a heavy dinner when they are tired and stiff. Then they think, see, it doesn't work anymore, try switching the time. For many couples, late morning works better or early evening before dinner. Keep the meal lighter, warm the room, make sure you've used the bathroom. Reduce distractions. These details sound small, but they reduce stress signals in the body. When the body is less stressed, the body responds better. You are not being picky, you are being wise. I also encourage couples to widen their idea of intimacy. Intimacy is not a single act. It is a full range of closeness that includes affection, conversation, and shared vulnerability. When couples only count one outcome as success, they create pressure, and pressure is the enemy of arousal. If you give yourselves permission for closeness without a strict goal, you often find that the body relaxes and responds more naturally. And even if it doesn't, you still gain connection, which protects mental health and relationship health, especially in older age. Now, if you want to include the food and herb part in a responsible, senior-friendly way, here is how I would frame it. Use food as a foundation, regular meals, enough protein, vegetables, healthy fats, and fiber. Add winter comforts in small amounts. A bit of ghee for warmth and satisfaction. A date or two for energy if your blood sugar allows. And warm milk or a suitable alternative for a calming routine. Treat ashwagandha as optional, not essential, and only after checking for medication interactions and medical conditions. The goal is not to boost yourself into strain. The goal is to support steady energy, stable mood, and better sleep. Please also watch for marketing traps. If a product promises to fix sexual function fast, be cautious. Many supplements are not well regulated. Some contain more or less of the ingredient than the label says. Some are contaminated, some are mixed with hidden drugs. Seniors are more vulnerable to side effects because the body processes substances differently with age. And because of medication use. The safest supplement for sexual health is often boring. Sleep, walking, blood pressure control, blood sugar control, and honest communication. Those are not flashy, but they are real. There are also times when a medical evaluation is the best next step, and it can be done with dignity. Seek help if intimacy becomes painful, if there is bleeding, if there is new pelvic pain, if there is a sudden major change in erections, if there is severe fatigue, or if there are symptoms like chest pain or fainting. Seek help if you suspect low testosterone or hormone concerns, but be cautious with hormone clinics that overpromise. Hormone therapy has risks and benefits that should be reviewed carefully. A good clinician will talk about the whole picture, not just one lab number. I want to share one last story because it shows what success can look like after 60. A couple in their 70s came back after we worked on sleep, pain control, and communication. They said, "Doctor, we're not trying to be young, we're trying to be close." They had created a winter routine. Short walks in the afternoon, warm showers, lighter dinners. More affectionate touch without pressure. And a simple bedtime drink that felt comforting. They also learned to stop when something hurt and to talk without blaming. Their intimacy was not louder, it was steadier, they looked calmer. They looked like partners again. If you take one message from this, let it be this. Your sexual life after 60 is not supposed to look like it did at 25. It can be better in a different way. Winter can slow the body, yes. But it can also soften the pace, quiet the noise, and make room for tenderness. Low stamina is not a sentence, it is information. It is your body asking for warmth, time, and care. When you respond with patience, with sensible health habits, and with honest connection, you can create an intimate life that feels safe and real. And that kind of intimacy does not fade with age, it grows.